Speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them as supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi, I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples in how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with the package. So somehow we have to really, really work with them. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars on ontology and psychology almost the same time.
And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, the show that is about you and all that matters in your life from psychological perspective, and through some of the interviews that I do with the most prominent psychiatrists and psychologists in the United States. I am so excited to have Dr. David Burns with me today, and let me tell you a little bit about him. Dr. Burns is currently adjunct clinical professor emeritus of psychiatry and behavioral sciences at the Stanford University School of Medicine. Now, where he's involved in research and teaching, he has received numerous awards, including the A.E. Bennett Award of his research on brain chemistry, the Distinguished Contribution to Psychology through the Media Award, and the Outstanding Contributions Award from the National Association of Cognitive Behavioral Therapists. He's actually been named Teacher of the Year 3 times from the class of graduating residents at Stanford University School of Medicine. In addition to his academic research, Dr. Burns has written a number of popular books, as you see it on the screen, on mood and relationship problems. His best-selling book, Feeling Good, The New Mood Therapy, has sold over 4 million copies in the United States and many more worldwide. Now, Feeling Good is the book most frequently prescribed for depressed patients by psychiatrists and psychologists in the United States and Canada. Surveys indicate that American mental health professionals rate Feeling Good as the number one book on depression out of a list of 1,000 self-help books. I am honored to have you with me, Dr. Burns. Welcome to my show.
Well, thank you so much. It's a great honor to be on your show. I'm real excited about it.
I know that you have been on my show before. We've been together once more. And for everybody who's watching us, if you like to see the last interview that we did together, please go to the YouTube channel that you see on the face of the TV right now, and go ahead and check that and go out and see that on there. And we actually did talk about depression and your new model that is T.E.A.M, T.E.A.M, and I think we're going to talk a little bit about that today also. But what we wanted to talk about, and I know that I've been in some of your lecture last December in the master's lecture from Ericksonian therapy, where you have talked about the distinct difference between the prescription medication and how it's affecting people after so many years of people taking it versus treating depression through psychotherapy and through the cognitive behavioral models, and now going from cognitive behavioral, which is something that you had utilized for so many years, and then now attending to this new model, which is called T.E.A.M.
Right. Yeah. There's so many things we could focus on. There's 3 pieces really. One is some of the, on the disturbing side, some of the new research that shows that this chemical imbalance theory of depression is probably not a valid theory. It's probably not the cause of depression. And some disturbing new research on antidepressants that indicates they probably have very few, if any, antidepressant effects above and beyond their placebo effects. So we could talk a little about some of that data, which is disturbing. It's upsetting for quite a few reasons, but I think important to talk about. We could also talk a little bit about the cognitive revolution, which has been really sweeping psychiatry and psychology for the last 40, 50 years, and then the new motivation revolution, which is bringing psychotherapy to an even more outstanding or fantastic level. We have some new breakthrough.
Somehow we lost you. I think for some reason we've lost the connection, and then we'll have them right back. So we're going to go to maybe a commercial, and then we'll be right back with you while we try to find Dr. Burns over the phone and over the Skype. Okay?
حالا شنیدی میگه از چاله در اومدم افتادم تو چاه. بعضی وقتا همینطوره، از یه اعتیادی ما در میایم، یه اعتیاد دیگه باید به جاش بیاد که فوران احساسات، چون همه اون کسایی که احساسی هستن، آدمای خوبی هستن، آدمای لطیفی هستن، میرن یه چاره‌ای برای خودشون پیدا میکنن، مثل سیگار، مثل مواد مخدر، مثل مسائل دیگه‌ای که تسکین بدن و مسکنی برای خودشون داشته باشن. حالا نمیتونن از توش در بیان. وقتی در بیان، اون وقت ما چیکار کنیم با اون همه هیجان؟
وقتی که یک نفر احساساتش کلا زیاده و نمیتونه که از شر این احساسات رها بشه یا نمیدونه که چجوری رها بکنه اون احساسات رو، اونجاست که خیلی از اشخاص ممکنه موادی استفاده کنن، کاری انجام بدن که حالت معتادگونه باشه، یا اینی که بیشتر و بیشتر زجر میکشن و یا عزیزانشون رو زجر میدن برای اینکه احساسات رو همینجوری پخش میکنن. عصبانیت، خشم، ترس، همه رو میریزن توی فضای خانواده و کارشون. بخاطر همین یک CD برای شما عزیزان انتخاب کردم که حالت هیپنوتیزم داره و خودتون یاد میگیرین چجوری خودتون رو هیپنوتیزم کنین. توی این هیپنوتیزم نه تنها یاد میگیرین بدنتون رو آروم بکنین، بعد یاد میگیرین تک تک این احساسات رو چجوری رها بکنین و جملات تلقین آمیزی برای شما گذاشته شده که یواش یواش خود سیستم بدنتون یاد بگیره که احساسات رو اسم بذاره، نامی براش بذاره، ببینه کجای بدنش هست و چجوری اینا رو رها بکنه به طور سالم که شما عزیزان انقدر درگیر نباشین. مثل اینکه احساسات و اعتیاد دیگه شما رو نگرفته، بلکه شماهایید که حس میکنین کنترل دارید روی اون فضای احساساتتون و میتونین رها بکنین. به زبان فارسیه و به زبان انگلیسی، دو نوع تکنولوژی هم توش استفاده شده. موسیقی بسیار زیبا که شما رو به آرامش میبره و تکنولوژی مانورو بیت که شما رو خیلی سریع ویو مغزتون رو میبره در تتا ویو که بتونین اینها رو خیلی سریعتر دریافت کنید.
اگر تنبلیم، اگر خجالتی هستیم، اگه وقت نمی کنیم، اگه دوست داریم کارمون رو خودمون انجام بدیم در منزل و اگر دوست داریم ارزون برامون در بیاد، حتما باید از این CD استفاده بکنیم. برای سفارش 818 451 4 تا 0.
Hi, we're back with Dr. David Burns. Dr. Burns, you would like to talk a little bit about the latest research that has come up about the effect of the antidepressants, as you were talking about it, that unfortunately it appears that it's having a lot of placebo effect versus actual effect from the antidepressants. Can you please elaborate on that?
Well, I think people often want a theory, even when we don't know the cause of something. And so years ago, people proposed that depression and anxiety resulted from a chemical imbalance in the brain. And it was kind of appealing because if there's a chemical imbalance, then maybe we can create pills to correct that imbalance and cure depression and anxiety. And for the last 50 years, that's been the main model in psychiatry. And you can't turn on the TV without getting an ad for some antidepressant or other. But there's been some very disturbing new research by a number of investigators, one of them Irving Kirsch at Harvard and a number of others as well, who have gone into the database at the Food and Drug Administration and have reanalyzed all the data that drug companies have submitted over the past 30, 40 years in an attempt to get some new chemical labeled as an antidepressant. And what these reanalyses show, and it's shocking and upsetting, and I'm a little reluctant to talk about it for that reason, because it does create a lot of powerful emotion in people, but the data seems to show that the chemicals that have been called antidepressants probably are not really antidepressants. They're just chemicals with side effects, but they don't significantly outperform placebos in controlled outcome studies. And it's pretty disturbing, because people have been told they want to believe in this model, and yet the emperor seems to have no real clothes. In addition, this chemical imbalance theory has never been validated. It was just something that someone made up, and for some reason people have been believing it, but I think the consensus now is that's an urban legend. It really isn't true that depression and anxiety are due to a chemical imbalance in the brain, a deficiency of the chemical serotonin. We just don't know the cause of depression and anxiety. The good news is that we have some fantastic new high-speed psychotherapy techniques, so that there's greater hope than ever for quick recovery from even severe depression and anxiety. But the chemical model and the chemical treatments have come into considerable controversy.
Now, when we're talking about depression and anxiety, are you suggesting that these studies have also said all mood disorders, such as even bipolar or extreme anxiety, which goes into obsessive compulsive disorders, that also those are not chemical imbalances, that those also have affected a placebo, or is it just like clinical depression that we've talked about, or chronic depression, or mild, generalized anxiety are the ones?
Yeah, well, I think we want to distinguish the concept chemical imbalance from the idea of a biological contribution. There are undoubtedly biological factors that contribute to all of depression and anxiety and IQ, and all normal and abnormal behavior has a biological basis. And there are some true brain disorders, such as schizophrenia and the severe bipolar 1, where people really have intense psychotic manic episodes. Those are true brain disorders. They're unlikely to be due to a chemical imbalance. We don't know what the biological cause is. We barely are beginning to learn how the brain works, and one day we'll have those answers. But it's unlikely that any psychiatric disorders are due to a so-called chemical imbalance.
Well, that's interesting. That's really a new concept that, as you say, I don't think that we hear a lot, because obviously we hear a lot of the advertisement for the medications and antidepressants, and what we're used to is when we go to psychiatrists that immediately we're offered this, like the antidepressants or anti-anxieties. And for us as therapists, obviously when something is, they come in with a condition which is severe, one of the things that we do for medical attention, we do refer them to a psychiatrist, and psychiatrists then therefore do that. So thank you for giving us the latest research on looking at what the placebo effects are, and that the ratio of that hasn't worked. But then now let's go to what works. You've talked about the revolution of cognitive therapy and then the motivation therapy. So can you please elaborate on that?
Well, the cognitive revolution goes all the way back to Buddha and Epictetus, a couple thousand years ago. The idea that our moods are created by our thoughts or perceptions. And about 50 years ago, a couple of pioneers, Albert Ellis in New York and Aaron Beck at the University of Pennsylvania began to take this idea that our thoughts and not what happens to us, our thoughts create our moods, and turn this into something called cognitive therapy. And it was based on the very simple idea that when you're depressed, you're giving yourself negative messages like, I'm no good, I shouldn't have screwed up, I'm a loser, I'll be depressed forever, there must be something wrong with me. I was working with a young man just yesterday, a really neat guy that had broken up with his lady friend, and now he's telling himself, I'll never have a loving relationship with anyone. I don't deserve a loving relationship. And those thoughts create so much pain. We then get something called emotional reasoning. We reason, I feel like a loser, so I must be one. I feel hopeless, so I must be hopeless. And the cognitive revolution is based on a very simple notion that when you change the way you think, you can change the way you feel. The very moment you stop believing those negative messages, in that very instant, your feelings will change. And that was the whole basis of what was called cognitive therapy and what I wrote about in my book, Feeling Good. And it caused a revolution worldwide in psychotherapy. When I first wrote Feeling Good around 1980, very few people had heard of cognitive therapy. It was considered a kooky, bizarre approach. When I first heard about it myself, it sounded like the power of positive thinking, or some slippery, slick, silly thing that I didn't think would help people with real depression. But the research has indicated that it does have fairly potent antidepressant effects. Even my book, Feeling Good, seems to relieve depression in about 2/3 of the people who read it within 4 weeks. So that was great, and cognitive therapy has now swept the world. It's the most widely practiced form of psychotherapy in the world, and the most researched. And just last week, I gave my first workshop in London, and I found out this is the form of therapy throughout London. Almost all the therapists there in England are now cognitive therapists. It was kind of shocking to see something I helped create that seemed so far out. When I first got into it, there were only about 5 of us in the world who were doing cognitive therapy, or 10. There were very few.
I remember. When I actually read Feeling Good, and this book has been translated to so many languages, including Farsi and Persian, and I read it in both languages, actually. It was very, very interesting, yes. And it was before I actually became a therapist, so I read that, and it was interesting, as you say, because it lands to your heart, knowing, like, when you're reading something, and as you're reading it, you know that it lands for you because it's the truth. And you have aha moments, but within aha moments of, wow, this is what's happening, but then it rings true to you. So that's why it's so easy to take it in and understand it and utilize it, even as a self-help model when I read it. And of course, yes, you were one of the pioneers that really helps cognitive behavioral, and it has become one of the evidence-based concepts in the sense of, all over the world, there's been so many research on it, and it does, in form of a brief therapy, it does change. And I think it's probably one of the highest rates of therapy which has created and alleviated depression in comparison with other therapies, right?
Yes, that's right. And when you recover, it is an aha moment. It's really what the Buddha was talking about 2,500 years ago. It's really enlightenment. It's a total transformation of the way you think and feel and experience reality. And the cognitive was really great. It was a big contribution clinically, and we started measuring things and doing research and making a science out of psychotherapy. And Albert Ellis and Aaron Beck deserve a tremendous amount of credit for what they did. But like any new breakthrough, over time it turned out it had limits. It doesn't work for everyone. And so lately, I have a weekly group at Stanford that's free for community therapists to attend and learn and get free training, more or less forever, as well as, of course, Stanford graduate students. And I have some fantastic colleagues, and we've developed a new innovation that you referred to as team therapy. but it's based on the motivation revolution. We've taken all of the good things of cognitive therapy and made them vastly more powerful. It's like cognitive therapy on steroids, and the gist of it, in a nutshell, is that we've learned that we're influenced not only by our thoughts and perceptions, but we also think and feel and behave according to the way we want. We believe things we want to believe. That motivation as well as cognition have a massive impact on our lives, on our feelings, on our relationships. And so we've developed now powerful new motivational techniques to melt away people's resistance before we use these cognitive techniques and behavioral techniques. And it's like a supercharged engine, and we're now seeing people recover at speeds that I would have thought impossible or preposterous as recently as 10 years ago.
Wow.
But it's very gratifying now to have even more powerful tools. I've always loved healing people and seeing people change before my very eyes. Last night we did a live demonstration in our training group. You know, the different therapists come and act as patients because, you know, as therapists, we're pretty much as screwed up as our patients. We have all the same issues, and so one of our training things is to treat one another to see if these methods really work. And the fellow who came in, I can't reveal any of the details about it, but he was pretty depressed and angry and ashamed and guilty and anxious and feeling kind of hopeless at the beginning of the group. And by the end of the group, it was just an evening training group. He was just in a state of joy, and it was so fantastic to see that. And I would say of the last 50 people that I've treated with significant depression or anxiety, about at least 45 of them have had a pretty much complete elimination of symptoms within one session. The first time I've sat down with them. And
that's an astonishing result. That's really an astonishing result.
It is. And when I was young, I thought, I wonder if such a thing is even possible. And now we're seeing that it is. But there's certain things you have to do to get that kind of result. Quite a bit of training is necessary. The techniques seem easy, but they're actually pretty sophisticated.
So and
challenging to learn. Yeah.
So should we go to the concept of T.E.A.M and look at it at this time?
Yeah.
So T.E.A.M.
Well, we can talk about it a little bit. One of the keys to it that we've begun to see. You see, I was trained to see depression as an illness.
Right.
So you're sick, I'm an expert, and I'm going to fix your brain chemistry with my pills, or your psychotherapy, your screwed up psyche with my psychotherapy. And now we have a new model where we see depression, for example, as an expression of the most beautiful parts of a human being. It's not your defectiveness, but the beautiful thing about you that causes you to be depressed. To give you an example is worth 1,000 words. A woman in our group who allowed us actually to do a video of an actual therapy session is a prominent Bay Area therapist, but she revealed during the start of a session that she's been ashamed and really depressed for 10 years because she's in her third marriage. And although she has a happy marriage, she's had 2 failed marriages, and she's the head of the counseling program at a local college. She has interns. She does couples counseling for her church as part of her volunteer work, and this was the thing that she brought to the session, that she's been hiding this from everyone because she's so ashamed, thinking she's not good enough. And that's so typical of depressed thinking. And the upsetting event, she got a call from someone in her church expressing condolences because over the death of her mother-in-law. She said, I had to tell her it wasn't my mother-in-law who died, it's my ex-mother-in-law. and I'm afraid she's going to tell people, and they're going to look down on me, and I'm a failure, and you know, people will think that men dump me, and on, and she was, you know, depressed and angry and anxious. And ordinarily we think, oh, we need to help her with all of these negative thoughts and all of these negative feelings. But when we use this new approach we call T.E.A.M, we take a little different approach and say instead, what are these negative thoughts and feelings show about you that's really beautiful and awesome? And I was never trained to think like this about clinical things. It was an entirely different mindset. And I together with her, we made a list. What are these negative thoughts and feelings show about you that's really kind of fantastic? And then all of a sudden it dawned on her, well, it shows that I have a lot of respect for love and marriage, and you know, it's her value system that causes her to feel shame and to feel the depression. It shows that she does value love and marriage, and it also shows that she's a very humble and spiritual person because she's criticizing herself and finding fault with herself. And also it shows that she's very realistic and honest. She has a sense of integrity, that she sees, you know, what her flaws are, and she's willing to face them, and on and on and on. And all of a sudden you come up with a list of 5, 10, 15 things that your depression and anxiety show about you that's really awesome. And then we say maybe we shouldn't make all of these disappear. Maybe we want to just reduce them a little bit. Like you're 90% ashamed on a 0 to 100. What would be a healthy amount of shame? You know, and then the patient might say, oh, well, let's reduce it to 30. Let's reduce it to 40. And what would be a healthy amount of anger? What would be a healthy amount of depression? And then you've made a deal with the patient's subconscious mind. Say, well, we'll reduce it to that level, but no further, because some negative thoughts and feelings are indicated. And then what happens? Then when you start working with the person, it becomes a slam dunk, and they push it all the way to 0 or 5 or some very minimal level.
Well, there's a couple of things I'm hearing as you're saying that this method that you're utilizing, as I hear it, there's a couple of things. One, instead of the client actually fighting with a part of themselves and trying to push that part away constantly and be at odds with it, they're looking at it as, oh, it's a part of me that I not only that I can accept, but I can also value because it has a function. So instead of separating themselves from those emotions, whether it's shame or those negative thoughts about themselves, and even the state that is uncomfortable, which is depression or anxiety, and pushing it away and having this battle, because the more you push it away, it pushes you. Now that you're looking at it as, oh, let me embrace it, let me get to know it, let me hear it, let me hear those parts of me, let me give them value. And therefore, instead of separation, I'm creating some sort of an integration of me and that part. But the other side that I'm also hearing from you is that you gain control over it because you're saying, oh, you know what, this parts of it I'm keeping, this parts of it I'm not keeping, and this much I can bring it from 100 to 20, so 80% of it I'm going to choose out and 20% I'll choose in. So the essence of control and power comes over that part of us, where usually people who feel depressed or anxious, they feel powerless against that part of themselves, and they usually say it's an automatic, I can't stop it, it runs me. And your approach shows them that no, nothing runs you, and you're the one who can be influencing that other part of you and actually be monitoring, getting in control of it, and you can choose it. You could choose how much of it you want, and you could choose what it does for you. Is that what I'm hearing?
Yeah, I see why you've got a TV show, because you express things beautifully, and that's really cool. I love the way you put that. Yeah, yes, that's exactly it. And then once the person gets on a roll, then we use all these techniques: externalization of voices, double standard technique, downward arrow, all these techniques that you know, many of them I developed way back as early as 1980 or before. But then you come in with those techniques and you hit the ball out of the park, and then the person wants, as they begin to feel better, all of a sudden their goals change, and they find that they can push the negative feelings away entirely. But yes, you're right. It's a paradox that when the patient becomes, or the client, whatever word you want, becomes proud of the symptoms rather than ashamed and fighting them, and accepts them and sees them as something beautiful, oddly, their resistance disappears, and then they want to change, and they pour themselves into the process, and they're collaborating with the therapist. And when two people are working together, you can work miracles. You can move mountains, and it's just been an astonishing discovery. I probably overselling it, and I'm probably making overly strong statements, but it's certainly the greatest thing I have ever stumbled across or developed in my career, and I think it could and should trigger a major revolution in psychotherapy.
Well, to me, it's if anybody could oversell, it should be you because of your background and what you have done. Yes. Now, part of the concept of TEAM, T-E.A.M, the T is for testing. So another way that I see that you're bringing your clients into that mode of being in power of the therapy, and you're not just the clinician and the authority in all of it, and they're just the passive bystander, is the testing part, which you do a testing at the beginning. So T stands for testing, and you do a test before the start of the therapy and the end of the therapy session, each session. So they go through this type of a rating that they do about who they are and how is therapy. And in this mode, not only they're letting the therapist kind of know that if it worked or didn't, but they also take responsibility for their own therapy. So again, they get some power in that. And I remember, as you know, Scott Miller has created many of the these types of testings, and I know that you have. So there are many different versions of these tests that are happening before and after to give the client an essence of, I'm part of this therapy and I choose to share my thoughts with my clients and with my therapist, and let them know if this is working or not working for me, and how they can support me, since I'm using my money and my time and their time to do this. Might as well they should know what works and what doesn't for me, particularly as a client, right?
Yeah, and there's another aspect to it too, but we measure and test the patient's depression severity, anxiety severity, anger, suicidal urges, before and after every single therapy session. How are you feeling at this moment? And in addition, at the end of the session, they rate the therapist in the waiting room on how warm and caring the therapist was, how helpful the therapist was. And this has also revolutionized the treatment for a number of reasons, not only the empowerment that the patient can criticize the therapist, but also the idea that I want to get you over your depression in today's session. It's not next week or next month or next year, at some vague time in the future when the recovery is going to happen. I'm going to try to make it happen at this very moment, right now in today's session. And we're going to measure it and prove if we're getting an effect. And I think this has also caused a major revolution. As you say, Scott Miller has picked up on it. He used some of my scales when he was a student. His supervisor required that, and I think he saw the power in it. And he's made wonderful contributions in this assessment revolution as well. But the thing about it is, if you ever watch sports, like you've got there the L.A. Clippers and the basketball, NBA, and when you see how well these people can shoot, it's fantastic. They develop an incredible level of skill. But the reason they get so skillful, it's not just the practice, it's not just the coaching, but the fact that they can see when the ball goes through the hoop. They get feedback, like a 15-year-old kid can go out in the backyard and shoot the basket 200 times. He's getting 200 correct feedbacks. It's like the basket itself teaches the kid how to shoot effectively. But psychotherapists do not have that ability because they're not measuring anything. So you can't tell when you're having a fantastic or a terrible session. And in addition, research we've done at Stanford shows that therapists who don't measure things, their perceptions of how their patients feel are way off base. They're less than 10% accurate. So therapists don't know when they're doing something great and when they're doing something terrible. They think they know, but they don't. And so therapists are stuck who are not using these new assessment tools. It's impossible to develop world-class skills. And I think that's another thing that has allowed my group at Stanford to develop this phenomenal new approach, because everyone is required to use these scales with every patient at every session and begin to find out not only how you come across to the patient, but when you're hitting the ball out of the park and when you're having a session that's not particularly effective. And so your patients become your greatest teachers.
Yes.
And when you have a patient recover before your very eyes and go from depression to euphoria, it has such a huge impact on the therapist. You say, I want to do this every time.
Exactly. And then what you were also saying, not only about the effectiveness of the therapy and the therapist, which is amazing because it will be faster. Therapy will actually create results faster, but doing the depression and anxiety and anger and mood measurement before and after, it also almost gives the connotation to the client, and it's the truth. I'm not saying it's a false connotation, but it gives the connotation to the client that this doesn't have to be years and years and years before I can wait, and my God, it takes too long before I get out of the depression, and there's no light at the end of the tunnel, and how long do I have to be here? Because they're actually monitoring and looking at the different aspects of the measurement, and for them, it also becomes tangible, where a lot of the conversations we have in therapy appears to be non-tangible and kind of abstract. And these measurements brings it from an abstract concept to a very, very tangible concept at each session in which the person actually has it in their hand and moving. So moving along from to E, which is empathy. And that is more of the context of the therapy as you hold this the concept of positive regard and having the person know that they're okay, like whatever experience they're having, their experience is okay and it's supposed to be there the way it is. So can you elaborate a little bit about empathy phase of the T.E.A.M model?
Well, I've developed a really sensitive empathy scale that patients rate the therapist after every session in the waiting room. It's a 5-item scale, and the score goes from 0 to 20, and the patient is answering things like, my therapist was warm, sympathetic, and caring during today's session. Not at all true, somewhat true, moderately true, very true, or extremely true. And then questions on trust, and questions on, did the therapist understand how I was feeling inside? And therapists initially think, I don't want to use that scale because patients won't be honest with me. But the fact is, the patients are honest, and therapists in the community who use my scale initially will typically get failing grades from every patient at every session on this scale, which is disturbing to them. But then we've developed some empathy training techniques to help the therapist learn to respond warmly and openly and respectfully to the criticisms of the patient. And this can really allow therapists to deepen the therapeutic relationship and to develop trust and empathy right away. Now, last night when I was working with this young man who was somewhat upset, he's a therapist, a high-powered professional, but like all of us, he hurts and has problems. And so at the beginning, I had a couple co-therapists I was working with as a part of the training, and then we had about 30 people observing the session and then asking questions from time to time. We'd stop for teaching points. And so we were using our empathy skills and reflecting back what he was saying, acknowledging his feelings, how much pain he was in, and et cetera, et cetera. And then after about 10 minutes, I was pretty sure we were hitting the ball out of the park, and I was ready to move on in the session, because my co-therapist had fantastic empathy skills. And then I said to him, now how would you rate us right now on empathy? Are we getting an A, a B, a C, a D? He said, well, you guys are doing great, but I'd have to say it's an A minus. And I said, oh, that's interesting. Tell us what we're missing. He said, oh, you didn't ask about, you know, this and this, a couple things that have been sources of great pain for him that he hadn't kind of thrown in there. I said, oh, tell us about that. That sounds really important.
Yeah.
And then he opened up and got into the things that were really eating away at him, and we just went to a deeper level. But you've got to be getting the feedback from the patient and respond with respect. And you say it empowers the patient. It makes the therapist has to be humble.
Yes.
To see that you do make mistakes all the time, and to honor the patient for pointing out the things that you're doing that aren't helpful.
And sometimes it's not that we're making the mistake. Yesterday I was working with a couple, and although I was just going back and forth and relaying some of the messages that each of them were going through, and trying to make myself understand what the client was going through, and then having the other partner understand. One of the partners, the male, the husband, got very offended from me, and he told me that you're taking my wife's side and you're not understanding me, and he left the room very, very angry, because there was also an essence that they were both calling each other a liar, and I was opening up the conversation of lying. And it was amazing that he called later on and said, I was very upset with you that you took my wife's side, and I wanted to tell you about that. So it was beautiful, because he was having the power to tell me. So I called him back, and I said, thank you for your authenticity. And I know that we were talking about lying, the concept of lying, and I really appreciate your authenticity of calling me and letting me know how I came across, although that wasn't my intention, but I can get how I came across. And so it also deepened the bond, and he created this power for himself, as thinking that if by any chance in that session he was coming across as someone who lied, that he was taking a courageous act of authenticity and was bringing it out. So it's amazing how much this type of not only the empathy, but the empathy that we do with the reaction that they have toward us, because it's no longer only about them and their surrounding, but somehow it suddenly we are in their world, and we are part of that relationship, and they do act with us the way they do act with the rest of the world, and it feels it becomes so important for us to know that piece. And these types of measurements are helpful, because many times someone like this client might not be this courageous to be able to talk, or they choose not to, or they don't know how to. So therefore, at this time, these types of measurements really help. Now we have about maybe 3 to 4 minutes, and I just want to complete the A and the M, which is agenda setting and then methods. Those are part of the team. So testing, empathy, and then agenda setting and methods. Would you like to really quick talk a little bit about those two pieces for within the next couple of minutes?
The agenda setting is kind of what I alluded to a little earlier. It's where you melt away the patient's resistance. You find out what, if anything, the patient wants help with in today's session. And it could be a depression problem, it could be anxiety, it could be a relationship conflict, or it could be a habit or addiction. And then once the patient comes up with, well, I'd like help with my marital conflict, or I'd like help with my my drinking too much, or my panic attacks, or my social anxiety, then we bring out the resistance, all the reasons not to change. I've developed 15 or 20 techniques to melt away therapeutic resistance, so that then you and the patient are working together. This has been the major innovation of what we call team therapy, and that's what's created this potential for extreme high-speed change, especially for depression and anxiety. Relationship problems are slower, habits and addictions are still slower, because the resistance can be so intense in those two areas. But then once you've melted away the resistance, I've developed, well, what I teach in my workshop is 50 basic methods, like called externalization of voices, where I might become the
other voice,
the negative voice in your
right.
head. I know what you're telling yourself. You know, I'm no good. I'm a loser.
Right.
And then, with your permission, I'm going to become the negative you and attack you with those thoughts and see if you can defeat me. And then do a lot of role reversals
Right.
back and forth. Or we use the double standard technique. What would you talk like this to a dear friend?
Right.
You know, why or why not? Or the individual downward arrow, the interpersonal downward arrow, the hidden emotion technique, the fantastic experimental technique for anxiety disorders. We have a lot of powerful techniques.
Right.
So once the resistance is melted away, then we come in with techniques to really smash the problem, whatever it happens.
And
to
I think
be.
for the therapists who also want to see you, I think you do have a workshop that is happening in Pasadena this coming weekend.
Yes. Now I had it. Oh, yes, I have it here. It's going to be Thursday and Friday, and it's at the Sheraton Pasadena. Registration is at 8. No, let's see. What's today? Wednesday, Friday, Saturday.
Okay.
So Friday, the registration will be at 8. We start at 8:30 and go to about 4:30 p.m. Sheraton, Pasadena, 303 Cordova Street, Pasadena, California, 91101.
So Saturday,
yeah,
May
Friday
9th.
And Saturday.
Okay. So Friday, May 8th and Saturday, May 9th in Pasadena,
right.
Sheraton. Wonderful. And they can also go to www.feelinggood.com, which you can see it on the screen.
Yeah.
And you can know where Dr. Burns' future events and talks are. And you can also read more about his new techniques. And you can also order all of his books from his Feeling Good, especially. And if any of you have not read it, I really recommend for all of you to take Feeling Good and read it. Thank you so
and
much.
one last quick
Please.
comment here. The workshop will be high-speed treatment techniques for trauma. Show how we can use team therapy to help people who've had trauma.
And this is for therapists, so the people who should
For
go over there are
but the general public often sneak into my workshop.
Okay, oh good.
You're really very welcome.
Fantastic. Then it's open to all of you. Thank you, Dr. Burns, for again taking my invitation, receiving it, and coming in. And I really, really enjoy, and I always learn from you, and hope to invite you again, and for you to accept my invitation for future programs.
Thank you, and congratulations on your brilliant and fantastic work, both on TV and clinically as well. It's an honor to work with you.
Thank you so much. It's such an honor to hear that from you. Thank you so much for being with us. Until the next week, create wonderful days, months, years, and a life.